Hi, I'm Sharrie Harlin-Davis, program host for Reid Beside You. And joining us today, we have Dr. Hira Ahmed from Reid Pediatrician. Welcome.
Thank you, Sharrie.
And this is your first time in studio, so please tell us, and welcome to Reid.
Thank you.
And how did you come to Reid?
So I'm originally from New York, actually. That's where I trained. That's where I did my med school and graduated about four and a half years ago, and then actually moved to Nebraska after that for a little while. Worked there for about 2 years in a rural setting, and then I decided to move my family over here where I can do outpatient pediatrics, do what I enjoy the most, and still have a great place for my family to enjoy and do a lot more things than out in rural Nebraska. So,
Well, welcome. We're happy to have you.
thank you.
And today we're going to talk about immunizations. And a lot of things have happened. So on immunizations, especially as we get ready to go back to school and making sure people are on schedule, on target for their immunizations. So how would we go about like scheduling an annual well check for your children?
Absolutely. So all kiddos should be having well checks every single year. After the age of 3, it's yearly well checks. And so we actually recommend that they come in yearly, even if they're not getting vaccinations. But school-age children, when they're first starting kindergarten, they do get their vaccines, their updated vaccines, and that includes DTaP, polio, MMR, and varicella. So they come in prior to starting kindergarten. They can even start as early as 4 years of age. Most of our kiddos come in before kindergarten and get their vaccinations done along with their well check. So you just call into our office and you can get a well check made.
And so what can parents expect from a typical appointment? And let's start off with like the smaller children, like elementary age.
Elementary aged. So when our elementary school age kids come in, they'll have their heights and weights checked. They will have a vision and hearing screen done if they're 5 years of age. Most of our younger 4-year-olds are not usually able to do the hearing test. They may be able to do the vision, so we'll get both of those done. And then usually our nurses will go ahead and ask some questions, and then I'll go in and see them. And what we're typically doing at the well visit is we're discussing their height and weight, making sure that they're growing appropriately, discussing any concerns that parents have, behavior-wise or eating, diet-wise, anything else that they may have concerns about. We'll discuss that, and then I'll kind of go ahead and talk about the things that are important for us as pediatricians. And so that typically involves making sure that they're getting a well-balanced diet. So making sure that they're eating their fruits and vegetables, making sure they're eating meats, they're not super picky. This is typically the time where kids get pretty picky. And so we kind of discuss that and how we can improve their diet if they are not eating everything that they're supposed to be. Making sure that they're getting enough water to drink. It's a big junk food type of age. So we make sure that even if they're eating junk food, they're eating it at appropriate times. Once a week is fine, not every single day, making sure that they're getting their water as well instead of just pop and juice and chips and cookies, which we all love it, but we also need to eat pretty healthy. We also talk about toilet training, making sure that they're toilet trained appropriately, and if there are any concerns around that, we can kind of talk about that at that point, what the issues seem to be during that time. We make sure that they are brushing their teeth and they are set up with a dentist, as they should be already. And if they haven't, then we have resources available we can connect them to make sure that they are able to do that. In addition, we will talk about any behavioral issues that come up at home, or if they're already in school, if there are any concerns, and address them appropriately. We also start talking about giving kids some chores to do at this age. I mean, they're starting to understand and becoming more independent, so I think that it's reasonable for parents to start giving them some chores to do. So we discuss that as well. And then typically I do a physical exam. We kind of do, head to toe exam, and then we talk about some other anticipatory guidance things after that, and then they get their vaccines.
And then as we move on to the teenage years, but let me just go back into that with elementary. So perhaps when they're getting their evaluation, what happens, or give me an example of they might not have met where they thought they should be at the height or the weight requirement. So how did you offer the resources that could possibly assist
So
them?
if weight is the issue, if we're underweight, then we start talking about food, what they're exactly eating. So I break it down and I say, okay, what are you eating for breakfast? What are you eating for lunch? What are you eating for dinner? We try to tease out where the issue may be, because 99% of the time it's the actual intake. Very, very rare is there a medical reason for why they may not be gaining weight appropriately. So that's kind of what we tease out first. And then on the exam part is where I go, and if I feel like there is no problem with the diet, then we kind of go down the path of looking at the exam and figuring out if there's any physical exam finding that would indicate there's an organic cause. And then we go down the workup cause, doing lab work if I feel that's necessary at that time. But most of the time, if they're underweight, it's usually a dietary intake issue. And so we start talking about how can we get some good fats into the diet. Peanut butter, avocados, all of those things have good protein in it. They have lots of good fats in it. That's what we try to add in. We sometimes, if they're very underweight, we'll add in something like Carnation Instant Breakfast or Pediasure. But I tend to stray away from those just because they do have lots of sugars in it. So unless they're, I'm really concerned about their weight, I won't add those in. And we'll try coming up with some recipes that parents can use at home to get some extra fats into them. Now, if we come on the opposite end, which we're seeing a lot more right now, is the opposite end of the spectrum, which is really a lot more kids and obesity tending to be the issue. We discuss in detail about junk foods and what they're eating, fast foods. Parents are busy. It's very difficult to cook at home every night. And so a lot of parents are eating out quite a bit, which it's very hard to control what kids are eating if they're out. Fast foods tend to not be the healthy ones. And so we talk at length about that and how we can maybe add in some fast foods that may be healthy. So instead of choosing McDonald's chicken nuggets every night, you may want to choose something like a Subway sandwich or a salad from McDonald's if you have to go there. We talk about frozen vegetables. I love frozen vegetables. I think they're amazing. It's the only frozen food that I feel actually has some good value to it. You pop it in the microwave for 5 minutes and you have a side dish right there. So things like that, we start discussing how we can try to help with that and decrease that weight. And I would say that all of my parents know that I'm very, very heavy on physical activity. So I always ask all their kids about physical activities. And especially this summer, I'm very, very happy to say that a lot of our kids have been outside quite a bit and not stuck at home watching TV. So I'm super excited about that. But making sure that they are going out, they're getting at least 30 minutes to an hour of physical activity a day, minimizing that TV, tablet, phone time to less than 2 hours a day if we can. So that's another thing that we kind of harp on.
And do you have, actually the entire family might need better eating?
Exactly. So my parents also know that I don't just tell the child what you need to do. I tell everybody, just don't buy the junk food. It'll make it easier for everybody in the family, and I'm sure everybody will lose a couple pounds if we don't buy the junk food. So we make it a lifestyle change for everybody in the house instead of one person.
So then we move to the teenagers. And what would happen with them in a wellness visit? And
So I'm going to start with my preteens first because I feel like they're kind of in their own stage where it's kind of a very awkward time for them. They're not children anymore, but they're not teenagers yet. So I kind of group them into their own category. It's a very awkward stage because some of them may be in the process of puberty and not understanding their bodies. So that's why I kind of treat them a little bit differently. So again, same things. We do their heights, weights. This time around, though, if they haven't had a hearing and vision, we may do that, or if there are any concerns around that. We talk with the parents the same way, but I tend to focus a little bit more on talking to the children at this point because they're able to tell us a little bit more and describe for us whatever may be going on with them. So, pretty much the same questions. And then really I harp on talking about puberty and pubertal changes that can happen at this time. And that's something that I discuss with the parents and with the child. I make it a point after I examine them to make sure I tell them that, okay, this is where you are in the puberty process and this is what you're going to expect. Just because it makes it a little bit easier. If it's a girl and let's say she's 9 years old, she could technically get a period. And so I don't want her to be scared that, I'm not ready for this, or what happened with me when I was a child. Nobody told me what a period was, and I thought I was dying when I was getting my period. So discussing that with the parents and being open, and sometimes that opens up the door for parent and child to discuss it openly as well, so that they can have more of a conversation when they go home.
Communication is a key.
Communication is key, exactly. Same with the boys. They start talking, if they aren't going through puberty, we kind of start describing these are some of the changes you're going to start seeing. So we definitely talk about that. I also start talking again about getting more responsibility on these kids now. They can do a lot more chores. They should be able to be involved in a lot of things at home. So we definitely start talking about that. And then I think pretty much everything else that we talk about with the younger kids, we also talk about it with our preteens.
And then we move to the teens.
The teens are a whole different ball game, that's for sure. They're completely different because now we have a lot more stuff going on. We obviously have the puberty stuff we talk about, but teens are spending a lot more of their time in school. They have a lot more of a social life than the younger kids do. And so we really start getting into how school and friends are influencing them. So we start talking about drugs, alcohol, tobacco, anything else. Vaping now is a big thing. So we start talking about that. And all of my parents know that after age 12, we spend a portion of time with the parent and the child in the room, but then I also ask the parent to step out so I can talk to the teen in detail, and it's their chance to ask questions that they may feel shy asking about in front of their parents, but it's also for a chance for them to be open with their doctor and say, this is what's going on with me. I don't necessarily feel comfortable telling my parent about it, which, I always encourage them to talk to their parents about it. And if they feel like they need a person to help them, that's where I step in and say, okay, let's discuss it together. But if they don't feel comfortable discussing it, there is a HIPAA compliance between my patient and I. And I always put that up front for them and say, this is everything that we talk about stays confidential unless you want to hurt yourself or hurt someone else. Then I do absolutely have to tell your parent. But other than that, everything stays between us unless you want me to tell them about it. And so that's where our trust relationship comes in. I feel like at that point, teens are way more comfortable telling me about what's going on with them. And so that's my opportunity to ask about what's going on at school. Is there any bullying? Bullying is a big factor right now. Do they have enough friends? Are they hanging out with their friends? And then mental health. Mental health is a big, big thing, especially since COVID started. Things seem to be getting much, much worse with that. So a lot of teenagers who are not experiencing any issues with depression and anxiety are at this point. And so I really take a chance to say, how are you feeling? How are you doing? Are there times where you are stressed? Are there times where you're having difficulty falling asleep? Are there times where you feel like there's an appetite loss and you can't eat, or you're eating too much? Are there times where you feel like you're closing yourself in your room because you don't feel like going outside, or you don't feel like seeing your friends?
Is the amount of time that is spent with the patient, is it vary between the children,
Absolutely.
preteens and teens?
Absolutely. I definitely keep more of an open, and this is different for every provider, but I definitely leave a longer time frame for my teenagers. And I never usually stop them. If there's a teenager who needs more time, I'd be more than happy to give them that time. It may mean my next patient will be a little upset at me, but everybody knows that I am more concerned about doing a thorough job and making sure all the concerns are taken care of than getting all my numbers in and being on time for the next patient. So yes, I do spend more time with our teenagers than our younger kids just because they have a lot more going on.
And also young adults. And what's the age group that you would consider young adult?
Mm-hmm. So young adult, I feel like really starts at age 12 and then moves on to, I'd see kids until age 18. But, they definitely continue into the 20s as well.
Okay. And now that school is about to start or will have started, it's so critical to find a routine.
Absolutely.
For the family.
Mm-hmm.
So can you give me some examples of?
Absolutely. So now that I'm seeing a lot of my families right now, and there's only a few weeks left before school starts again, we definitely are discussing, okay, your kids were going to bed, at 11 or 12 o'clock instead of 8 o'clock. We need to start thinking about switching that back. You can't do it the day before. It has to be about a week beforehand where things need to change a little bit. So we start talking about, starting to, even though there's not a whole lot going on during the day, get back into your routine of having a bedtime routine, whether that involve you want to take a bath before bed, you need to brush your teeth, you need to drink some warm milk, you need to read a book, whatever it is that parents do with their children as a bedtime routine, you need to go back to doing that and do it at the same time that you would do for school nights, which is typically around 8 to 9 p.m. for most children. So we just start talking about that. For my kindergartners, I start talking about, okay, this is going to be completely different now. You're going to have a routine. You're going to go to school every day. You're going to come back home. Start talking to parents about, okay, do you have after school care for your children? What is that going to look like? Who's going to be taking care of them if parents are working? We start talking about getting in to see the dentist as well. If they haven't already, then they need to make sure that they go to the dentist every 6 months. So that's some of the things that we do talk about.
And what about this? I know it's a big one. Decreasing recreational screen time to get ready for scholastic school time.
Absolutely. So like I said, most of my kids this summer have been doing a great job with being outdoors and not being in front of the screens all day. So I'm really excited about them, very, very happy about it. But like I said, I always harp on less than 2 hours a day. Whether it be school, whether it be the summer, we got to minimize it as much as possible to less than 2 hours and try to find other activities to do. So right now it's summertime. There's a lot more they can do, riding their bike, jumping on a trampoline, going to the park, various different activities that they can do. And then once wintertime rolls around, we start talking about, okay, what are some other things that you can do that may be indoors, but that doesn't require you being in front of a screen. So a lot of the time we'll talk about exercise and maybe, turning on a YouTube video and dancing to that. As a family, you can dance to it. And that's, it's a little bit of screen time, but you also get your physical activity in that way. Reading. Reading is a big thing, and everybody knows I always push it too. So read as much as you can. There's no limit to it. As many books as you can. Go to the library. And library's not even a thing anymore. I feel like everything's on a tablet now. But seriously, go to the library and pick up an actual book instead of going on your tablet. So.
And I know our local libraries have various options that you can look at things on the tablet and check technology out through that. So that's an addition that we have available in the community.
Absolutely.
And another thing is sleep. And I have friends with their children, their grandchildren will complain. And one of the things that's always, the sun is still out. Why do I have to go to bed now?
Absolutely.
So give me some examples on the recommended amount of sleep.
Absolutely. So this is going to vary depending on age for sure. So our youngest, babies, they need, more than 13 hours of sleep, 13 to 16 hours. Our younger preschool to kindergarten and younger elementary school kids, they need 9 to 11 hours of sleep. And then, we should all actually be getting 8 to 9 hours of sleep. We don't. But teenagers should definitely aim for 8 to 10 hours.
Then when you were saying, do teens really sleep more during high school? Because I've seen in a lot of studies that they're changing the start times for teenagers. So what's your opinion?
So I don't feel like teenagers sleep a lot more in high school. I feel like what ends up happening is that they go to bed a lot later and then they wake up later, or they'll take naps during the day to try to catch up, so to say, on sleep. So when I have a teenager who comes in and says, I'm tired all the time, I'm constantly wanting to sleep, or they're yawning in my office 5 times during the visit, and I say, well, when did you go to bed last night? When did you wake up in the morning? Did you take a nap? Were you waking up in the middle of the night? And oftentimes I'll find it's broken up sleep. but it's still less than the amount that they actually need. And so that's why they're tired all the time.
Great. And keeping people up to date on their immunizations. And I know in the last couple of years, and added with COVID, people are totally off their schedules. So what's the recommended schedule for children from kindergarten to the 12th grade? I'm just doing an overview of immunizations.
Immunizations, okay.
Yes.
So for kindergarten, when they come in, we make sure that they have all their previous immunizations. And with COVID, a lot of patients who would have normally come when they were younger, in that toddler range, didn't show up. So now they're coming in 2 years later, and we're trying to catch them up with all their shots from when they were babies. And so we try to do that as much as we can and so I'm the type of person who goes ahead, and if I have to give 6 shots to get them up to date, I will do it. Okay. Everybody knows that. I'd rather do that and make them protected rather than wait and potentially have a person who's not going to be able to come back for their next set. So I will do that, and then they'll get their kindergarten shots. We talked about DTaP, polio, their measles, mumps, rubella, and their chickenpox vaccines. They'll get those. And then COVID is the other one that we are starting to recommend. It is actually approved, and we just started offering this week for 6 months and above as well, 6 months to 4-year age range. We have that available at our Reid office as well now. But all our kiddos that are school age, they've been getting it for a few months now, and we are offering it. We definitely have some good response. We have a lot of people who are getting it for them. So that can be given, the COVID vaccine can be given with all the rest of the immunizations. There is no problem with it, and the reason for that is it works very differently from all the other immunizations. So that there is no risk factor. There's nothing that's going to cause any side effects with giving them together. So we give them whenever they can come in and get them done.
So do they have the option of coming to your office, or do they go to the residency clinic?
Absolutely.
Where do they go?
So they can come to our office. We have it available in our office. They would just call, and we can get them in either for a nursing visit if they had already had their well check, or if they're due for their well check, they can come in and get it in during that time. Absolutely.
Okay. And then I know a lot of people are starting to do college orientation. So what are some of the changes that they should do as they begin their journey to college to keep up with immunizations, this transition more to adulthood?
Absolutely. So the preteens, I forgot to discuss about their vaccinations. So when kids are going into 6th grade, we do another set of vaccines after that. And so we're typically updating them on their tetanus, their pertussis vaccines. We're giving them HPV vaccines, which are optional, but I say that it should be routine to get HPV vaccination as well. It's the only vaccine that protects against cancer, so I think everybody should get it. And then meningitis we give during that time as well. And so then after the 11-year age range, they come back again at 16, which is in high school, and they get their booster meningitis shots during that time. And then when kids are coming back right before college, we're giving them, colleges have a special type of meningitis strain that goes around, and it's called meningitis B. And so we try to get those kids vaccinated for that so that they don't get it in college dorms.
Okay. And another thing are student athletes. And one of the things we have found about discussing, what about concussions in sports? Do you see people come in? I know we have our sports trainers and medical fitness, but what happens from a pediatric standpoint?
So I think from the pediatric standpoint, I am on the more preventative side on how can we prevent concussions from happening. So we talk to teens about making sure that they're staying safe, they're using their protective headgear when it plays a factor. So we really are more on the preventative side on how can we prevent this from happening. Once a concussion happens, we do have a concussion clinic, and so most of our kids end up going through there, or they're going to the ER if they have more severe symptoms. And we may see them for follow-up, at their well checks or months later. And so we typically will talk about, well, how are things affecting your school? How are you able to function in school because of that concussion you had? There are some kids who have lasting effects, and so we want to make sure that we're helping them the best that we can.
I've seen a study that says that there are more girls with concussions than boys.
I guess I haven't read that
Oh,
yet.
I don't know.
Yeah.
Just didn't know that.
I guess
but-
all the kids I've seen, I feel like are always boys.
I always hear that. So I always
They're always a little bit
that,
more rough, I feel
Right.
like, so.
Or maybe I was thinking maybe the boys are more protected. They're thinking of that more than some of
It's
the
possible.
girls.
It's possible. I didn't know that.
I don't know. But well, did you have anything else you'd like to share with us?
I think that I just want parents to know that, now that we're going back into the school year, there are definitely some parents who were not, didn't have their kids in regular school this year and the year before because of COVID. And they're going back into a mainstream school this year. And so just make sure that, they have their sleep routine down. They are seeing us for their vaccines. Think about the COVID shot. Make sure, now that they're going back into and seeing other kids, that they're being protected. Make sure that they're eating healthy diets, minimizing that junk food. And then talk for kids who are in that age range where they can get into sports, start thinking about sports so they can start interacting with more kids now. I mean, we've all been quarantined for so long. I feel like we've kind of lost some of that ability to be with friends and meet new people, and we need to kind of go back into that as much as we can while still protecting ourselves. So get your COVID vaccine and go out and let's try to get back into a regular lifestyle again.
Well, on that note, I want to thank Dr. Hira Ahmed
Absolutely.
from Reid
Thank you.
Pediatrics for joining us today on Reid Beside You.
Thank you so much.
Thank you. And we thank our audience today for watching us on Reid Beside You. Thank you.